think for us as the eye care providers, it really is our job to show the patient what's available, what lens options that we can give them to help them live a better life, to help them feel better about themselves, to like how they see themselves. So I think it's our job to introduce the one-day ACUVUE Define family lenses to the patients and let the patients decide whether this is a lens they want to purchase or not.
When I'm thinking about the ACUVUE Define lens, it starts with the patient history. When I first meet the patient and I'm asking questions, I'll ask them, do you ever feel like your eyes look tired? And if a patient answers yes, it's a clue that they're looking for something that makes their eyes look a little brighter, and I can have the ACUVUE Define lens on their eyes later to show them what it can do for them.
The ideal patient to try the one-day ACUVUE Define brand contact lens would be a woman in her 20s or 30s who you can see is very conscious of her appearance and who already wears contact lenses.
We are introducing the one-day ACUVUE Define brand contact lenses to pretty much everyone, men and women, young and old, patients who are just nearsighted. Those are very easy to introduce it to them.
I'll also look for patients who seem to have an interest in aesthetic enhancing procedures. Certainly women who use eyelash extensions, or you can tell by the careful makeup that they're wearing that their appearance is important to them. Those are patients that will really enjoy the benefit of the ACUVUE Define.
We basically don't say no to anyone regardless of what they're coming in for. We always say, hey, we got a new one-day ACUVUE Define, would you like to try it? And we always have them try it, because even if they're coming in just for glasses, we want to give them the option of having the one-day ACUVUE Define.
My staff is very well trained, and particularly my contact lens technician. She also works at the front desk, and she knows our patient population very well. So she introduces this lens as often as she can.
It's called Define. It's defining your natural eye. It's not changing the color completely of your eye, it's enhancing what you already have.
We like to make a game out of fitting the one-day ACUVUE Define lenses.
Twice a week here we have our Define days, where each one of our staff who work with the patients, we put on one contact lens on one eye and leave the other one with a clear lens. So when patients come in, they'll notice our eyes, and we are able to branch out and let them know about one-day ACUVUE Define lens.
We want to see how many patients that day we can get a big smile out of them. And it's really fun to see that moment when they put it on, they look at themselves in the mirror, then they look back at you and say, oh my gosh, you just made me look younger, or oh my gosh, I can't believe how pretty these are. We love those oh my gosh moments from our patients.
I don't spend too much time describing the lens, because descriptions just don't do it justice, and photos don't do it justice. You really have to see the lens on the eye to appreciate what it can do.
We started using the language that we hear back from our patients. So what we keep on hearing over and over are, oh my gosh, these lenses make me look younger, they make my eyes look brighter, and they make the color look bolder. So we start incorporating that language into what we say to the patients. Would you like to try this new daily disposable one-day Define lens that will make your eyes look younger, bolder, and brighter?
Well, I'll tell the patient about this new lens, and I tell them that the name of the lens, Define, fits the product perfectly because it defines where the dark part of their eye meets the white of their eye, and this will enhance the beauty of their eye, making it look larger, as well as enhancing the natural anatomy of the iris.
It's like wearing eyeliner for the eyes. I think the most important thing in fitting ACUVUE Define lens is to wear the lens yourself as the doctor. It just helps for the patient to see someone in the office wearing the lens and understand how it works and understand how it is different from a colored lens. In selecting one of the variants, it's good for the doctor to pick the first one. If you try to explain it to patients, they really have no reference for knowing what you're talking about. They haven't seen a lens like this before. It's a completely new type of a lens. For my own practice, I'm usually pulling the sparkle first for patients with green or blue eyes, shimmer for patients with hazel eyes, and shine for patients with brown eyes.
Our contact lens technician has been with the practice for many years, very comfortable with so many of our patients, knows them so well, so I really do defer to her once I hand the patient over to her to try the lenses as to which lenses she'd like to work with.
I normally just will do one at a time, put one in the right eye, not in the left, and then normally what I'll do is have them see that effect, make sure that they see the difference. I could tell them it looks good, Dr. Boscia could tell them it looks good, but they need to see it for themselves. So it's very important that you do it in office.
We recommend that they take a look in the natural light. The way the office is set up, it's very easy. We just walk up to the optical floor. There's plenty of mirror out there. We have them take a look to see if they like how their eyes look in the natural light.
Someone who goes in shopping by themselves, they don't really get that feeling of, oh, I'm gonna look great. They want support. They want someone to be like, you look awesome, and they'll feel great once they wear it.
We've had patients tell us that this is the lens that brought the sparkles back in their eyes. And we're happy to do that for our patients every day.
Handing patients trial lenses and letting them just try it without a follow-up visit leaves it kind of open-ended. And I don't like that. I like to have them scheduled with a follow-up, and then at the 1-week follow-up I can address any questions or concerns they might have and tie up that annual supply order.